Dear students, the title of our topic today is Poisoning by Sedative Hypnotics. During managing a case of barbiturate poisoning, we should keep in mind other causes that may induce the same clinical picture. This includes other causes that may induce CNS depression. CNS depression can be also induced by other sedative hypnotics such as benzodiazepines, can be also induced by opiates, alcohol, and carbon monoxide poisoning. In order to find out whether the presented clinical picture is due to exposure to large doses of barbiturates, we should perform some investigations. The investigative approach to a case of poisoning will be discussed in details in the general toxicology, but here we will concentrate on the investigation that tells us about the exposure to barbiturates. The investigations in a case of barbiturate poisoning include the serum level of phenobarbital, which is a long-acting barbiturate. We can measure the level of phenobarbital in the blood, and other routine investigations such as ECG, CBC, which means complete blood count, blood sugar level, kidney and liver function tests, and the level of electrolytes in blood such as sodium and potassium. The first step in treating any poisoned patient is to stabilize the vital functions of the body, the respiration, circulation, and other vital functions. In order to achieve this stabilization, we have to perform emergency measures. The emergency measures are summarized under the abbreviation ABCD. ABCD approach includes saving the airway, saving breathing, keeping the circulation maintained, and giving drugs that stabilize the vital functions of the body. First, after performing this stabilization, we can go to the next step, which is decontamination. Decontamination means removal of the unabsorbed poison from the site of exposure. And the site of exposure in our case here is the stomach. So we have two tools for performing decontamination. The first tool is the gastric lavage, and the second tool is giving activated charcoal. Gastric lavage is usually done within the first hour after exposure to the poison to remove the poison from the stomach. But in some cases of barbiturate poisoning, the poisoning is associated with delayed bowel movement and delayed gastric emptying. So the poison will stay for longer time in the stomach, and in this case we can perform the gastric lavage after more than 1 hour of exposure. Another problem here is that the patient with barbiturate poisoning have also CNS depression, and CNS depression is usually associated with depressed protective reflexes, and performing gastric lavage may lead to aspiration of gastric content into the airway and developing respiratory failure. To protect the patient against this complication, we can perform the gastric lavage under protected airway using cuffed endotracheal tube. Activated charcoal is given to absorb the poison, the barbiturate, in the stomach and prevent further absorption into the blood, and it will be given or should be given in a single dose, because the delayed bowel movement or the decreased bowel movement may lead to intestinal obstruction if we give activated charcoal many times or several times. After elimination or after decontamination, we can perform the elimination of the poison. This means enhancement of excretion outside the body. As we said before, multiple doses activated charcoal increases the efficacy of absorption of the residual drug, but it may be more harmful, especially when ileus is present. We can also perform alkalization in case of elimination of long-acting barbiturates, because alkalization of urine is not effective in case of poisoning with intermediate and short-acting barbiturates. Alkalization of urine is also indicated in case of developing rhabdomyolysis. This will be discussed also in details in the chapter of general toxicology. Hemodialysis, hemoperfusion, can be also done for elimination of long-acting barbiturates. in some cases, such as severe intoxication not responding to the supportive treatment, and if the patient has acute renal failure. The second group in poisoning by sedative hypnotics is benzodiazepines. Benzodiazepines are called the safest of the sedative hypnotics. Why? Because the range between the therapeutic dose and toxic or lethal dose is extremely wide, so the use of benzodiazepines is relatively safe. In this slide, you can see the generic and trade names of some commonly used benzodiazepine preparations, such as diazepam, lorazepam, clonazepam, clonitrazepam, and midazolam. As usual, while speaking about a case of poisoning, we should recognize how does poisoning occur, or with other words, as we said before, what are the modes of poisoning. Benzodiazepine poisoning may be suicidal, accidental, or homicidal. Suicidal poisoning by benzodiazepines is usual in adolescents. Accidental poisoning is common in the elderly with low tolerance to CNS depressants and can also occur in persons who don't have enough experience with intake of benzodiazepines, and they may take benzodiazepines in relatively large doses. In addition, criminal use of benzodiazepines to facilitate robbery and rape is also reported using short-acting drugs. What is the mechanism of toxicity by benzodiazepines? Benzodiazepines enhance the action of the inhibitory transmitter GABA, leading to increased frequency of chloride channel opening and subsequent hyperpolarization and CNS depression. The clinical picture of benzodiazepine toxicity is similar to that of barbiturates, but it is less toxic and less severe than barbiturates. Death from benzodiazepine poisoning is uncommon unless the intake of benzodiazepine is combined with other CNS depressants which potentiate the CNS depressive effect. The investigations of a case of benzodiazepine poisoning include urine screening for detection or for qualitative detection of benzodiazepines in the urine. But here we should take care. Some laboratories are not able to detect the new groups of benzodiazepines. Other investigations include CBC, arterial blood gases, ECG, blood sugar level, liver kidney function tests, and electrolytes. In similar way, we start treating a case of benzodiazepine poisoning by stabilization of the vital functions of the body using the emergency measures described in the ABCD approach. The ABCD abbreviation means saving airway, saving breathing, keeping the circulation maintained, and giving drugs that maintain the vital functions of the body. After stabilization of the patient vitally, we can go to the next step, which is decontamination. Again, decontamination means removal of the unabsorbed poison from the site exposure, and the site of exposure in our case here is the stomach. So we have two methods for decontamination of the stomach. We can perform gastric lavage and we can give activated charcoal. Performing gastric lavage should be done under protected airway to prevent aspiration, pneumonia, and respiratory failure. Activated charcoal can be given to absorb the benzodiazepine inside the stomach and prevent its absorption into blood. After decontamination, we can try enhancement of elimination, but we should keep in mind that enhancement of excretion of benzodiazepines outside the body is not very effective. On the other hand, we have another possibility to antagonize the effect of benzodiazepines on receptor level using
flumazenil. Flumazenil is an antidote for benzodiazepines, and flumazenil is a generic name. The trade name of flumazenil is Anexate and is widely used to antagonize the effect of benzodiazepines. Flumazenil is a selective competitive inhibitor of CNS benzodiazepine receptors, but as any medication, as any drug, may also induce complication and side effects. Flumazenil may induce seizures, convulsions in patients co-treated with tricyclic antidepressant overdoses, because flumazenil lowers the threshold for convulsion. So, simultaneous use of benzodiazepines and tricyclic antidepressants is associated with high risk of developing convulsions. Flumazenil can also induce acute withdrawal symptoms, including seizures and autonomic instability, especially in patients who are addicted to benzodiazepines.